We'll be starting in a couple minutes. We'll be starting in about 1 minute.
Good afternoon, and thank you for joining us today for the weekly update from the Lake Cumberland District Health Department regarding COVID-19. We have some members from our executive team who will be answering questions that we have received over the past week. I do want to remind you that if you have questions, you may type those in the chat box, and we'll answer those as we go throughout the meeting. Mr. Crabtree, I'm going to turn it over to you to see if you have any updates you want to share with us before we start answering questions.
All right. Thank you, Tracy. Can you hear me okay?
I hear you just fine, yes.
All right. All right. Thank you, everyone, for joining in. I'll give you our situation update as far as our total cases. We've had 259 total cases in Adair County, 19 of those deceased, 223 released, 17 active at the moment, all of those on home isolation. 237 in Casey, 13 deaths, 204 released, 20 current active cases, 19 of those isolated, 1 in the hospital. 63 total cases in Clinton, 1 death, 49 released, 13 current active cases, 11 isolated, 2 in the hospital. These were numbers as of last night. 83 total in Cumberland County, 0 deaths, 66 released, 17 active cases, all on home isolation. 116 in Green, 5 deceased, 60 released. And when we say released, we mean we've released them because they're no longer contagious. That leaves in Green 51 active cases, 49 isolated to the hospital. Macquarie 71 total cases, 0 deaths, 51 released, 20 active cases, all on home isolation. 487 cases in Pulaski, 6 deaths, 391 released, leaving 90 active cases, 86 isolated, 4 in the hospital. 163 total cases in Russell, 5 deaths, 134 released, leaving 24 active cases, 22 isolated, 2 in the hospital. 184 total cases in Taylor, 4 deaths, 143 released, leaving 37 active cases, 31 isolated, 6 in the hospital. 85 total cases in Wayne, 0 deaths, 81 released, leaving 4 active cases, 3 isolated, 1 in the hospital. That's 1,748 total cases for the district with 53 deaths. 1,402 released, leaving 293 active cases. 275 of those are on home isolation and 18 are in the hospital. As of last night, at 293 active cases, that's the most active cases we've had in our district since the onset of the outbreak. And we're going to break our record again today, it looks like. As of a few minutes ago, we're adding 42 new cases today, at least, it looks like. 1 in Adair, 3 in Casey, 2 in Clinton, 1 in Cumberland, 1 in Green, 4 in Macquarie, 10 in Pulaski, 7 in Russell, 9 in Taylor, and 4 in Wayne. Interesting or notable things today, some of those are long-term care related. We have a new death to report today, an 80-year-old female long-term care resident in Greene County, and we have, of our 42 new cases, 4 of those will be in the hospital. So we could go up to 22 hospitalizations, hospitalized today, if none of those that I mentioned earlier, those 18 are released today. So last week was our worst week since the onset of the outbreak as far as new cases, as far as complexity with the several nursing home outbreaks, a lot of cases in the hospital, a lot of deaths. So this thing certainly hasn't let go of us yet. I was doing some calculations this morning. I'll just share some things with you guys. It took us 113 days to get to our first 500 cases. On the 113th day, we were at 514 cases. To get our next 500, to get to 1,000, it only took us 20 days, 20 additional days. And then it took us 20 additional days beyond that to get to the next 500, which was 1,507. And now 7 days into this next 500 cycle, which would bring us to today, we're at 1,748. So it's taken us about 7 days to get to halfway to the next 500 mark. So we're on track to get to our next 500 mark quicker than the 20 days it took us to get to the last 2 500 marks. So the spread is elevating, the speed of the spread is elevating in our community. Now that's concerning, but in that first 113 days where it took us to get to that first 514, during those 514 days, we were averaging 5.5 people in the hospital on any given day. Now that next 20 days to get us to the 1,000 mark, we were averaging 13.6 people in the hospital per day. Then the next 20-day cycle to get us to that next 500, the 1,507 mark, we were averaging 18.5 people in the hospital a day. And now for this last little piece of the next 500 cycle up until today, as of when I looked at this for the numbers yesterday, we're averaging 19.7 in the hospital the last 7 days. So our hospitalization, the number that are being hospitalized is increasing over time, which that's a little deceptive because our hospitalization rates historically compared to state and national averages have been low. We're just now getting to the point where our hospitalization rates are starting to align with more along the lines of state and national averages. So, we're not doing better in that regard anymore for sure. Of course, the scary thing is, all of the mortality and all the hospitalizations we had during that first 500 cycle was spread out over 113 days. The next group was only spread out over 20 days, and then the next group over 20 days. And now we're probably going to get to the next 500 mark quicker than 20 days, and all of the mortality and hospitalizations we experience will be spread out over a thinner number of days or a fewer number of days. Now that's problematic because we worry about our hospital capacity. Right now, our cases are doubling about every 30 days. That was as of yesterday. And when COVID patients end up in the hospital, they have a tendency to be there longer than your average patient. So if we're doubling our cases and increasing our hospitalization too quickly, the COVID admissions are going to start overlapping. The need for that hospital space, you're going to have people already in the hospital tying up those beds that they have designated for COVID beds when new people are trying to get in. So, we're not there yet to the breaking point, but we're playing with thinner margins than we've ever played with or been experienced before. So that's something to be of noteworthy. So I heard some people talking, or I read some people on the internet talking about our mortality rate, that the disease must be lowering in its potency. I was looking at our nursing home outbreaks just this morning out of interest, and some things that jumped out to me. The first nursing home outbreak we had in Adair County, 18.6% of those that we knew were positive passed away. Now, I can't know what I don't know. I don't know that every nursing home tested at the same interval. They may have had some cases that we're not aware of, but I can only tell you what I know. For the next nursing home outbreak we had in Casey, it was 13.8% mortality rate of known cases. The one we had in Russell County was 25% mortality of known cases. And again, they may have not tested as many as the other facilities. In Greene County, the mortality rate was smaller at 4.3%. That's still an active situation, though. It's not fully resolved yet. We have Taylor County right now has 11.7% mortality rate in their nursing home, and that's still a live event. It's not totally resolved yet. And we've got 2 outbreaks in Pulaski County that's not resolved. So, you know, there's the mortality rate is remaining pretty high is my point. So it's definitely not something we want to mess with. The other complicating factor is, you know, several of our area schools are going back to in-person instruction, and they're doing it at the time when we are at our worst as far as our spread and our the number of new cases we're getting, how quick things are doubling. You know, we're near the peak of this thing. Now, I'm not saying it's not going to get worse. I'm saying that we're at the worst point we've been at so far, and we're getting ready to add into that, putting a bunch of kids in a confined space for several hours a day. So how's that going to impact our community spread? We don't know yet, but we will know in 2 or 3 weeks. So it's something that's concerning. So I will stop there with my opening comments, Tracy, and we'll go to questions.
Okay. My first question is for you, Dr. Wayman, and it's a rather long scenario, so I'm going to sort of paraphrase it a little bit, but the question is surrounded around quarantine time. And they had, it's from a lady, I'm assuming, and she said her son was tested in August on the 10th and was positive for COVID. The family quarantined around August the 10th, it looks like. He has since recovered from COVID and he has been released from quarantine. But the question they have is, they were advised to be tested, and that since the test on the 10th, they've been, I'm sorry, I'm trying to paraphrase, it's rather long. They have been advised to quarantine for an additional 14 days after their son was released. So they said they've been on quarantine for 14 days and they have some more time to go. Can you just explain what the quarantine time for that?
Okay. So can you hear me okay?
I can, yes.
Okay, so quarantine is implemented to catch anyone who may be incubating the disease from spreading it. It is 14 days from the last contact with the infectious person. If that person, the case, is a non-household contact, in other words, you no longer have exposures, then that day, and then you are quarantined for 14 days. If that person is a household contact, in other words, they are sick in your household and they remain contagious for usually a minimum of 10 days and sometimes longer depending on the severity of the illness. So we count from the exposure of the last infectious day, which means we add 14 days to the 10 days that that person is in isolation, and that makes it 24. Sometimes it may be longer if that person is sick for many more days than 10.
Yeah, so it's unlucky if the person that is a positive case is living with you, because you don't get off quarantine 14 days after they're no longer contagious.
Right.
So that can make it a long stretch for some people. I understand, but that again, that's you're wanting to make sure that that person if they have contracted it on that last day, that household member was contagious, it could take them 14 days before they start showing symptoms, and we're trying to control it. So really, that's the thrust of the whole public health response. If we can identify contacts of positive cases, and if we evaluate them to be high risk, we want to get them quarantined before they become contagious. And then if they become a case, they're already on quarantine and they've not been spreading it. So that's our part that we're trying to play in controlling the spread of this. Of course, the public's part is if we isolate you or quarantine you to follow our directions until we tell you it's safe, that you're no longer at risk of spreading it to other people. There was a question on YouTube Live, Tracy. I'll go ahead and hit that one. It says Greene County Schools refers to a 7-day active case rate rather than the number of cases. How is this figure and where can that be found? Let me start with where the data can be found. If you'll go to our website, there's a lcdhd.org. There's a big COVID-19 banner right at the top of the page. If you click that, it'll go to our main COVID-19 statistics page. That's different than our daily brief page. And there's a couple places on that page that displays that. There's a map about halfway down that's color-coded red, orange, yellow, and green to align with the state's color coding system. You can see the days, whatever the 7-day active case rate is, you can see it for that day on that map. But if you go on down the page a little bit, there's a link to something called the master data set. And that gives you our master data set for all of our 10 counties since the first day of the outbreak. It shows since day one how many positives, who all was released, who was in the hospital, the number, not who, but the number of people that passed away and so forth. It also calculates for each day, for each county, the growth rate, the mortality rate, the hospitalization rate, the 7-day active case rate that you're talking about, and so forth. Let me just define some things for you for a minute, and then I'll tell you how we calculate that number you're asking about. Positivity rate is a number that, or is a figure that we hear, or an item that we hear discussed a lot recently. That's the total number of positive tests divided by the total tests given. And you can calculate that for the whole event or for a certain, like if you wanted the positivity rate for a certain drive-through clinic or whatever. But it's difficult for us to get the positivity rate because labs and doctors' offices aren't required to report to us negative tests, only positive. So at a local level, we really never know how many tests have been given. So that's a difficult number for us to calculate. The state gives an estimate of that number. You know, they have the different labs giving them a summary report where they can calculate it statewide. I know the federal government puts out in their report a number. I understand that federal number is probably flawed because they're using something that doesn't fully take, you know, it doesn't measure the total tests either. They're kind of giving you their best guess too. But I guess probably the state numbers are probably about as good as you're going to get with that. Infection rate is how many cumulative positive cases you've had divided by the total population. So you're getting a percent of how many people in your population has tested positive. What you're referring to is the 7-day incidence rate is what we call it. And what you do there is you take the 7-day average of new cases. So you add up the new cases for the last 7 days, divide that by 7, and you get the average number of new cases over the last 7 days. You divide that by the population. And it's just showing you how active the spread is in your population for any period. And again, I've showed you where you can find that data. And I will say you can also find that on the state's page. But the state's data is usually about 2 or 3 days behind our data. I think when I posted the numbers last night, there was maybe 70 cases that we are reporting that the state's not reporting yet. And that's because they validate the data differently than we do. You know, we enter the cases as soon as we get the lab confirmations. So, you know, the most accurate data is our local data. Now, occasionally we'll have to change our data a little bit if we find out something new, but for Lake Cumberland data, the most accurate data is on our website. The mortality rate is deaths divided by total positive cases. The hospitalization rate is hospitalizations divided by total cases. Growth rate is, we use a 7-day average growth rate. Anyway, you take the average number of new cases over the last 7 days and you divide that by yesterday's total cases. It's just showing you how much the cases are growing each day. And from that, you can extrapolate how many days it takes your total cases to double, which is the days to double based on the growth rate. So you can find all that information in that master data set that's on our website. Other questions have popped in. You may have covered this already. I'm just now getting on, but can you explain the 2 cases from Madera this week that was added and released the same day with a release date of, I think it was May. When sometimes we release a case the same day we add it, depending on what kind of test they had. There is an antibody test that you can take. That doesn't measure whether you have the test at the moment. It's measuring whether you've ever had COVID-19. And so some people get that test just to see if they've ever had it. They may not be symptomatic at the moment. They just want to know, well, have I ever had it? So a couple of people took that test. They discovered that they had it sometime in the past, but the issue has resolved now. It's a past. They're no longer contagious. It was several weeks or months ago, several days ago. But so in those situations, we would add them to our total cases, but they would never be a new case for us because their situation's already resolved. Is that pretty close, Dr. Wayman? What are the current guidelines on youth football practice? I'm from Macquarie County, where we are still having practices in pods and no contact, where surrounding counties are fully practicing. Stuart?
Okay, so as you know, I believe that last week KHSAA, Kentucky High School Sports Athletic Association, came out with some recommendations to go ahead and let schools have their football. Now, that recommendations that they sent out was not approved by the governor nor the Department for Public Health or the local health department. What happened is the governor did not cast it down, or he did not go against them, but the official guidance is still practicing in the pods and only training. That is still the official guidance from the governor's office, from the Department for Public Health, and from the health department. We have seen outbreaks in football teams already, and just what they're doing. So right now we are not actually recommending anything beyond the practicing in pods and the training. So that's where that's at right now. As further guidance comes out, we'll be able to take a look at that and update that. But right now, the only guidance is what has been so far.
And since the governor hasn't prohibited other kinds of practice, some schools are choosing to practice more full contact.
Right, that's right.
They're doing it against the advice of public health at the state and local level, though. We certainly in no way encourage close contact anything at this moment. We are at the worst of our outbreaks since this thing began, and the more people you're around in close contact, the worse you're going to make this. And we've got a lot of people right now that are really fed up with this pandemic, and they're determined to go back to life as normal, regardless of if life is normal or not. And the consequences of these decisions we're going to start feeling 3 to 4 weeks from now. And I hope I'm wrong. I sincerely hope I'm wrong, but we'll see the change in cases in 3 to 4 weeks, we'll see the changes in mortality and hospitalizations probably a couple of weeks after that. So, 5, 6, 7 weeks from now, we're going to be feeling the impact of these decisions we're making now, and it'll be too late to put the genie back in the bottle. Once we get to a certain tipping point in our communities, it's being spread so widespread. There's no getting it back unless there's another absolute lockdown. There will be no way to contain it. So, somebody asked a question on here. It says, I was told by an employee at the extension office that they expect meetings to go back up to less than 50 by the end of the month. Is that possible? It may be possible, and people may do things that we wouldn't recommend. We're still saying to people, anything that encourages gatherings is not advisable during a pandemic, especially at a time when we see such rapid growth locally. You may question the governor's numbers or the federal numbers, and you may even question our numbers, but our numbers are lab-confirmed cases. And we call these people that are these 1,700, what is it now, active, 293 active cases. We call these people every day. They're real people. We talk to them on the phone. And I had the opportunity to call a few of them myself the other day, and I'm telling you, this is a real thing. It impacts people very differently. Some people don't have many symptoms. Some people that would otherwise be young and healthy, they can't taste anything, can't smell anything, tell me that their legs are tingling, and they've never experienced anything like it. So, I don't know what to tell you. Don't be around people any more than you have to be. Keep your distance. Wear your mask. Be safe. We're treading some thin ice here. All right. So Tracy, you want to jump back into the questions?
Yes, I've got a few more questions. Who is considered a close contact to someone with COVID-19?
Anyone who spent 10 to 15 minutes within 6 feet of that person is considered a contact. We count that from 2 days before the person got sick and throughout their contagious period.
Okay. And then the next question is, am I considered a close contact if I am wearing a mask?
If you spent 15 minutes at less than 6 feet, yes, you are still considered a contact. Masks protect the person's not wearing them, the other person, probably more than they protect you. Even though they do protect you to some degree, they are not 100% effective. So we always err on the side of caution to try and stop the spread of this COVID-19.
And again, you've got to keep in mind the thing that we're trying to accomplish is if we know you're a high risk, if we know that you're a high risk close contact to a positive case, we're trying to get you quarantined before you would be contagious and spreading it. And that's how we're approaching this. That's our response. So we're certainly just trying to do what we can to keep individuals in the community safe. I think, Tracy, was there any more questions?
No, there was not, but I was just thinking as you were sharing this, Sean, you might want to share where the majority of the cases for our district are. I think you have that little ring on our website. You might want to reference that and share that with individuals.
Yeah, that changes every day. And again, this is, as Tracy said, it's on our website. I'm going to try to pull it up.
As Sean's looking at that, I will make the comment. I just, here at our district office in our operations center, we have, this is where a lot of cases end up coming in, and then we put those cases out to our contact investigators. And today, as of this moment, we're probably looking at 60 cases. And usually more cases trickle in by the time it's all said and done and we're able to put out our daily report. So this is going to be our largest day of cases. And again, like Sean said, I mean, when you add school and you add things like football and sports into that, and our cases on the increase like they are, and not being able to know. I mean, once we see those cases start happening with those type things, I mean, the aftermath of that is 3 or 4 weeks later. So we're in a pretty scary situation right now, potentially to have things get out of hand.
One of the issues, a lot of the area schools, the ones that I know of, the metrics that they're using to decide whether or not to be open is looking at community statistics. And if the schools themselves are causing the increase because they're putting kids into that environment, and knowing that the statistics probably aren't going to be changing at the community level for 2 or 3 weeks, that's 2 or 3 weeks of indecisiveness where decisions really need to be made. So I would always encourage the schools. There are situations where, there could be something other than in-person instruction in the schools causing the increase. Like right now, we're having a big community increase. So looking at the community data can be informative. But for the schools, I mean, looking at what's happening inside your buildings is a much better indicator of what you need to do. If you're having spread inside your buildings, don't wait until the community numbers go up. Deal with it at that moment, and I think they will. I mean, I believe everyone has got the best intentions in their heart, whether we agree with their decisions or not. I think everyone's heart's in the right place, and no one is trying to set out to damage the community or the children. But really look internally, not externally. Look externally, but don't forget to look internally too at your numbers. Don't just wait for the community statistics to tell you what to do. So where's our cases as of, and remember on this donut chart on our website, there's a footnote that says this is neither comprehensive, exhaustive, or necessarily mutually exclusive. And what I mean by that footnote is we don't always know everything that a case is tied to. It's not exhaustive in that situation. It's not comprehensive, and then it's not mutually exclusive, meaning one case can be tied to more than one situation. You may have gone to church, and you may have gone to work, and you may have gone to school. You may be one person tied to 3 different scenarios, so you can be counted more than once in this donut chart. It's the only chart on our website. That's why we have that big red footnote, that so you know that this you have to understand what you're looking at. But 30.7% of what we've got documented is tied to long-term care facilities right now. That's the biggest one. We've had outbreaks, significant outbreaks in 2 long-term cares in our district, and we've got a couple new ones that's just starting to brew right now, so that may stay high for a while. Businesses was the next highest one. Families the next highest one after that. Places of worship is next after that. Travel, and then schools. So schools is moving up. There's several other categories. Schools right now 6.9%, and that's not really from in-person instruction. That's just from the schools getting ready for in-person instruction, having more teachers on site, and then having youth practices and so forth. So we're seeing the increase with school-related things just from the preparations for school. So that's kind of where we are with those things, Tracy.
Okay.
We're getting close to the end of our program here. So if anyone wants to post a question, we have about a 20-second delay between what we're saying and what we see show up on our YouTube live screen. So I'm stalling. So if you have a question, you can put it in. Do you guys have anything to add at this point? We are at a frightening time. It seems like there's a lot of people in our communities who are just good people, good-hearted people that are really wore out with COVID-19 and just bound and determined to ignore what's happening at the moment and to just go forward with pushing for, you know, group meetings and in-person schools, and it's a scary time. Scary because we know we have a lot of hospitalizations right now, adding 4 today, and that our hospitalization rate now has risen to the state average level, and you know our cases are expected to double every 30 days. I mean, the next 6, 7, 8 weeks can really tell the tale. If we get to the point from a public health perspective, if we're getting so many new cases a day that we can't do the contact tracing, then you're removing one more variable from the equation that's in place to try to prevent the spread. Now, what am I talking about? When we find out of a case, we call that case, we find out everyone that they've been in close contact with, we call those contacts, we further assess the situation. If we, find out that they've been in that person's space within 6 feet, 10 to 15 minutes, or, there may be some other factors, and we quarantine them, if we're catching them before they turn positive and start spreading it, then we're helping control the spread. And if we get so many new cases, we don't have time. We don't have enough hours in the day and enough staff to reach out and do all those contacts. You're taking away one of the things that has worked to help keep the spread slow. And, we're nearing our breaking point as far as how much we can handle. And I guess in that scenario, we would still reach out to the cases, and maybe we would just ask them to call the people they feel like they've been in contact with and tell them to quarantine. Because, if we just don't have enough staff to contact tracing ourselves, I don't know what else we could do other than make just a general public statement that we're not able to do it anymore, protect yourself, and ask the cases to reach out to their own contacts. And that's not where we want to be, but we've got a lot of growth right now. Okay, I've stumbled along and stalled as long as I can. I don't see any more questions. It says, thanks again for keeping us informed. We have 73 people watching live, so that's a good number for our live broadcast. And, usually there's a few hundred people that watch this on delay. So thank you all for joining in. Tracy, do you want to tell people how they can submit questions and about how often we do this forum?
Yes, if you all have questions, please send those in to the health department, Melanie Williams, or you can put them in on our website. We have a little icon where you can send messages in, and we will be back on next Wednesday at 2:00 Eastern Standard Time to answer those questions. Thank you all for joining us.
Thank you all.